Hello guys, welcome to my YouTube channel. In this channel, I talk about pregnancy, I talk about labor, I talk about delivery, I talk about everything about nursing and midwifery, family planning, and reproductive health. My name is Nurse Valerie. I'm a registered nurse midwife and a certified family planning service provider. Today, I'll be talking about preconceptional care or preconception care. So, if this is what you want to hear, or these are the topics that you like hearing, then please subscribe to my YouTube channel, like this video, and share it with your friends. So that being said, let's get started. So I have about 9 points or 9 things I'm going to be listing out while discussing about preconceptional care. But I will start with the definition. What is preconceptional care? Preconception care or preconceptional care is the care that you give to a woman who wants to be pregnant, or a woman who wants to conceive, or a woman who is preparing to be pregnant. That is preconceptional care. So many people, maybe they get pregnant without preparation, but nothing is like preparing for something before the arrival. Remember, proper preparation makes things easy. When you prepare for something, you welcome it in a very easy way, and you flow with it very well. So preconceptional care helps you to adjust, do some changes, both lifestyle changes and maybe work changes, behavioral changes, habits, eating, everything about you. Because whatever you do invariably affects your baby. So now I'll be starting with your vitamins. If you're a woman who wants to conceive or you're trying to conceive, you have to start with some of the multivitamins that will help both you boost your fertility, or boost your not really boosting your fertility, just help your reproductive organs, because sometimes people may be lacking some of these vitamins and they don't know, and these vitamins are very vital for the development of the fetus. So it's very good that you have these vitamins already before conceiving, even while you're pregnant. Do you understand? So I'll be listing out some of the vitamins that you need to be taken while you're waiting or trying to conceive. So number one is folic acid. Folic acid is very, very essential even in pregnancy, especially during the early stage of pregnancy. If you're lacking folic acid and then you conceive, your baby may have neural tube defects. So that's why you see every pregnant woman is encouraged to take folic acid additionally, apart from the one they get from their diet. These vitamins and minerals, you can get it from your diet when you eat green leafy vegetables, but it's also essential, it's also good that you take them as a supplement in order to help both prepare your body and also help your baby. Apart from folic acid, we have vitamin D. Vitamin D is the one you get early morning sun. If you go during very early in the morning, that early morning sun around 8 9 10, that type of sun helps your body to produce vitamin D. So vitamin D is very good for your reproductive health. Another vitamin is vitamin E. Vitamin E is very good for reproductive health. So if you can take it as a supplement or you can get it from the food you eat, is very, very good. You see vitamin E in cod liver oil. So vitamin E is very, very essential for your reproductive health. The next vitamins is the vitamin B12. It's also very essential that when you take this multivitamin as you're preparing to be pregnant, it's essential that you take this multivitamin in order just to prepare your body for the reception of your fetus or the embryo. Okay, the next one is weight control. You have to ensure that you control your weight if you're preparing to be pregnant. If you're a mother that is trying to conceive, you have to work on your weight. Sometimes when you are overweight, it may hinder you from conceiving. But when you work on your weight and ensure that you have a reduced, depending on your body mass index, you achieve at an optimal weight control is very, very essential. It's not that those that are obese and overweight, they don't get pregnant. No, but it's good that you control your weight. Excessive weight gain predisposes you to so many things, hypertension, diabetes, and all that. So it's very good that you work on your weight. If you're trying to conceive and you know that you are overweight, you work on your weight. At least you achieve a body mass index of about between the range is between 18 to 25. Below 18 is underweight. Above 25, you're going towards overweight. So you just have to achieve your body, let your body mass index fall between 18 and 25. So you need to check your weight. You need to know what you eat. You stop eating junks and all that in order to ensure that you control your weight. So while you're if you're exercising and in the course of that you discover that you're pregnant, then you have to cut down on the type of exercise you are doing. But it's good that you achieve an optimal weight before you conceive. Then the next one is stress. You have to avoid stress. Stress releases the stress, not just that it destabilizes your hormone, it also destabilizes your system. When you are under stress, you discover that you'll be having an irregular menstrual cycle. You will not even know when you are ovulating. You will not even know when your menses is coming. You cannot track them. Your whole system is destabilized. You may not even you may feel constipated. You may not take care of your general well-being. Stress is not good. Stress predisposes you to hypertension, excessive stress. So if you're the type that is under stress, maybe your work or anything that predisposes you to stress, that makes you to work yourself, that you are being stressed out every day and you're trying to conceive, I will advise you to cut down on your stress level, because any woman that is trying to conceive, being stressed or working in a stressful environment is not good for you. So the next one is rest and sleep. Then it has to go with stress. You have to ensure that you have an adequate rest and sleep. When you rest rejuvenates the body. When you sleep, it reduces your stress level. That is when your hormones at its peak. When you're stressed, you destabilize your system. Your hormones are destabilized, they become irregular. You'll be having hormonal imbalances, but rest and sleep will rejuvenate your body. So if you're trying to conceive, my advice for you is to ensure that you have enough rest and sleep. The fifth one I want to talk about is smoking and alcohol. If you're the type that smoke, then you just have to cut it down. Because if you're trying to conceive and you're smoking, no, no, no. Smoke harms the baby. It's not good for your reproductive health. Just like alcohol, both male and female. If you're the type that takes alcohol and you're trying to conceive, then you have to cut down, if possible, stop your alcohol intake, both the man and the woman. Alcohol is not good for the baby. It causes fetal alcoholic syndrome. So while you're trying to conceive and you're the type that takes alcohol, then you have to cut down on your alcohol level, or if possible, stop your alcohol intake. Then the sixth one is you have to stop all birth control. If you're taking some birth control, maybe you're under hormonal birth control, IUCD, or any form of artificial family planning method, you just have to remove them. I will advise you to remove them early enough. For example, sorry, if you're using injectables, then you have to remove it for like 6 months, 6 months ahead of the time you're planning to conceive. If you're using the pills, you have to stop it like 2 or 3 months ahead of the time you're planning to conceive. If you have an implant, you have to remove it a month ahead of the time you're planning to conceive, because all these things affect your hormone because they inhibit ovulation. So while you're trying to conceive and you have this, you know that they are working against you. So you can't achieve pregnancy while you're under some family planning contraceptives. Then the next one is preconception care visits. Going to the hospital is good that if you are a lady or a woman who is preparing to be pregnant, that you start a preconception care. There are some hospitals, they used to have preconceptional care days where they care for couples who are trying to be pregnant. Some of them call it fertility clinic and all that. So when you this visit helps you to know if there are any medical or surgical condition that is hindering you from conceiving. So this, when you visit and they check, they will run some tests and scans, check your hormones, do some abdominal pelvic scan and all that. So this will review if you have anything that is hindering you or preventing you from conceiving. So this visit will help you to work on it. If you have to undergo surgery, maybe in the case of large fibroid, you may remove it because fibroid will prevent you from being pregnant. Even if you are pregnant, sometimes it can cause miscarriage. So that is why you need to start a preconception care visit. Visit the doctor, visit the gynecologist, go to hospital, just check your body, check your hormones. It's very, very necessary. It's part of the care you get if you're the type that is trying to conceive, especially those that have been trying for a very long time and you are not achieving anything. It's good that you go to the hospital. Then the fourth one is track your menstrual cycle. When all these things you've stopped them and you've achieved all, you're resting, you're sleeping, you've reduced your stress level, you're not taking alcohol, you're not smoking, you've reduced your weight and all that, then you have to track your menstrual cycle. You have to know when you are ovulating and maximize your fertility period. Because if you don't know when you're ovulating, you may be missing your time. Because when you track your cycle, when you know when you're ovulating, when you know when to meet with your partner, it will increase your chances of conceiving. Some women, they don't know how their cycle works. They don't know, but when you understand your body and understand your menstrual cycle, it will help you to achieve your aim, that is conceiving. So I have another video on how you can track your menstrual cycle, how you can track your ovulation, how you can know when you're ovulating or not. You can also watch the natural family planning method, which I've already I talked about. I released the video last week. So in that video, I have a detailed explanation of Billings ovulation method. But if you don't want to watch the video, I have other videos that I talked about how you can track your menstrual cycle and your ovulation. So you can watch those videos and it will help you on how you can track your menstrual cycle or your ovulation. So that's just all. You have to maximize your fertility period. Maximizing your fertility period will help you to hasten up and conceive, because if you don't know your fertile days, when your pap days are approaching, the egg white days and all that, how will you know when you're ovulating? So it is good that you track your ovulation, your ovulation days. You understand? Know your menstrual cycle very well and know when you're ovulating. It will help you to maximize your fertility period and achieve pregnancy. I hope this video benefits somebody out there. If you have any question regarding this video, please, I would like to know at the comment section. Meanwhile, don't forget to subscribe to my YouTube channel, like this video, and share this video. I remain your favorite nurse, Valerie. Thank you for watching. See you next time. Bye.